your Houston chiropractor, Dr. Gregory Johnson, and today we have a special guest into Houston, all the way from Saudi Arabia. Nader has come over here to the United States, Houston, for treatment, which is very specific in the spinal decompression. So we're going to show you how we're going to take him through the analysis. We've already looked at his MRIs, and we're going to decompress his spine and adjust him three-dimensionally so that we can take the pressure off the nerves that are causing his back and leg pain. Okay, good. Let's face the mirrors there for me, Nader. And let's flex your head forward and then backwards. Now, just like we always do, we're checking the posture and then stop at neutral. There you go. Now, as you can see, he's got a little bit of forward head posture. And from the side here, I'm looking, his head is translated to the left. So that's bringing his right shoulder high. You see that in the mirror? Yes. And then also, if you look in the pelvis here, you see your pelvis has moved to the left of center. And you also, are you a side sleeper most of the time?
Yes, I sleep on my right hand all the time.
You can always tell by looking at a person's posture exactly what their spinal biomechanics are. And it does help to have the diagnostic studies done as well, which we have. Okay, very good. Now, I'm going to do an examination on him to rule out any other pathology. So I'm going to have you lay on your back right here for me first then, Nader. And head up here and legs down there, please. So this is called, on your back with your head here. No, on your other way, on your back. Okay, there you go. That's it. This is called an orthopedic neurological examination. And first thing I'm going to do is what's called a straight leg raise test, or LSAGS. Now, is there any pain in your back or sharpshooting pain in your leg when I bring it up here besides the pulling in your hamstring?
No.
Okay, does this feel better down here?
Yeah.
Okay, is there any back pain when I do that? That's called a Braggart's test. That was negative. Now, just let that flop down. I'm doing this, it's called the Fabry-Patrick test, and I'm pushing down. Is there any pain in your hip joint there? Okay, good. Now we're going to do a muscle test while we're here. I'm going to push straight down, and you hold it up. Try to hold it up. There, good. He's got a good, strong psoas muscle. So we isolated that. That's excellent. Then we come over here, and we do a straight leg raise test. Pain in your low back at all?
No.
Okay. And any pain in your low back or leg? So he's got a negative straight leg raise and negative Braggart's. Any pain in your hips right there? And a negative Fabry-Patrick test as well. Good. Now let's test his psoas over here. I didn't do that. Okay, hold this one up. Excellent. Got good strength. Good. Okay, let's come over here on your stomach for me. Actually, sit right there first. Now go ahead and sit up and face that way. Okay, this is called a maximum foramina compression test. Is there any pain in your spine anywhere? Now we're going to go backwards and right. How about when I do that? No pain here? Okay. That's negative. And how about this side? That's also negative, okay? Now tilt your head to your right shoulder. Is there any pain here? Is there any pain when I do this? Okay. That's a shoulder depressor test, and that's also negative in his case. This one's a little tighter though, huh? Okay, good. Now turn and look this way. Okay, he's got good range of motion left. Now let's go right. And equal range of motion on the right. That's good. Next thing we're going to do is evaluate his reflexes. Okay, just let that relax. Good. That's the biceps reflex. That's the brachioradialis, and there's the triceps. All those are +2, equal and active, which is normal. Go, and of course you can go ahead and scoot back just a little bit there. Yeah, boy. He's got plenty of good reflexes, not neurologically damaged in that regard. Good. Excellent. Okay, now let's have you lay on your stomach with your face right down this little piece of paper. So now I'm going to the palpatory examination, which is where I'm going to evaluate his entire spine and pelvis. Here we go. Here's place your hands right there and relax. There you go. Now, first thing we always do is we check the leg length, and as you can tell here, he's got a 1/2 inch short on the right side. But as I bring it up, see it already is getting longer, and that tightens up in your low back there, doesn't it? Natter, do you feel that tighten up in your low back?
Yeah.
Okay. Do you sit on this wallet all the time?
Yes. Yeah.
Yeah. Tender right there, isn't it?
Yes.
Yeah. See, the wallets, when you sit on a wallet, that causes your pelvic muscles to contract, and just like women carrying purses on one shoulder more than the other one, they will be out. See, those are all sore. Yep. Now, lock your leg straight and lift this whole leg off the table on this side. Just the whole leg. Okay. Did that hurt to do that?
Yeah, that's it.
Okay, go ahead, relax, and do the same thing over here. Okay, good, and relax. This is called a sacral deviation test. And he had a little problem with that on the right side as compared with the left side, but not a lot. And just palpating his sacroiliac joints right here, both of those are swollen and tender. That's tender, that's tender, that's tender. He's got hypertonicity, which is just less than muscle spasm in his lumbar spine. And we get up here in the mid-thoracic spine. He's got vertebrae out of place in his mid-back and muscle hypertonicity on both sides. Now right here in the trapezius muscles, he's got knots. You feel those?
Yes.
And then we're going to let your head down just a little there. Yep. And its atlas is out right there on the right, so is C2. And C5 and C6 is also there on the right. Now, when you find subluxations like this, they're usually global in nature. It's not just one vertebra moving out of place. It's whole sections of the spine and pelvis. So, now that we've determined that he doesn't have any other serious pathology going on by the orthopedic neurological exams and looking at his MRIs, we are going to begin adjusting him with his sacroiliac first on the right side. The sacroiliac joints are much more of a problem with sciatica, actually, than lumbar spine disc herniations. And a lot of people overlook the sacroiliac joints as opposed to making sure that the sacrum, the middle bone inside of the pelvis, is centered up and level. Because when it's off, it's just like the foundation on a house. It's going to be crooked, and everything else above that will get compensatorily involved. And that's what we usually see on patients who have subluxations or misalignments in their pelvis, sacroiliac joints. We'll see a compensatory reaction all the way up and down the spine. Okay, now we're just going to relax, and we're just going to breathe easy here. And nice and easy here. Good. One more here. Just relax everything. Excellent. Got one more little one right here. That's it. Very good. Now, we have adjusted his pelvis, sacroiliacs. His legs are even now. Did that hurt as much as the first time?
No.
Good. Okay. Since this is his very first adjustment here, we are going to take it easy on him and do some very deep vibratory therapy on his muscles throughout his entire body so that we can get the blood circulating more freely. Brings oxygen and nutrition into the muscle cells and tissues. But it also helps carry out the metabolic waste products of normal cellular metabolism. So I put quite a bit of pressure on these. Those are a little sore in your calves, aren't they? Yep. There we go. Now he's really going to be probably pretty sore on the sides here. A lot of people call these on the side of your thigh IT bands. They're really the tensor fasciolata muscles. Deep pelvic muscles there is gluteus medius and piriformis. Now see, you can see that wallet right there is actually getting in the, gets in the way. So if he's sitting on that, what's going to happen, he's going to stimulate the gluteus medius maximus and piriformis, and guess what? Muscles move bones, they're going to move that pelvis out of place. So I would advise him that when he gets done here today, that he puts that in his front pocket instead of wearing it in his back pocket. It'd be a lot better on his spine and a lot safer for his money. And then we're going to put some nice, deep, steady pressure again all the way through the muscles and tissues and throughout the entire spine. Right there and right here. Now, Natter found us, by the way, on YouTube. So, all you YouTube subscribers that have been watching this for the last year, many of you have come to see us from all over the country. And we're starting now to get international patients coming in as well, which is great. Because the things that we do here are so much more hands-on than a lot of clinics. We don't put people on electrical muscle stim or hot packs or roller tables, things like that, which are therapies, and some of them are beneficial, but we can give patients TENS units to take home if they need that. But ice is always the most important instruction you want to leave a patient with, so that it decreases the inflammatory response. You don't ever want to put a dry heating pad on anything that hurts. Might feel good while it's on there, but it won't last and it will cause more inflammation down the road. Alright, so bottom line is that should feel a lot better. Did that feel smoother to you?
Yeah.
Okay, let's turn you on your back now. There you go. There, and just put your hands right here on your tummy and relax. There you go. Alright, now just let your head go right in my hands here. And you notice I'm getting way low here and adjusting his lower cervical. Now that moved really good right there too. And upper thoracic vertebra. And I'm going to decompress him from the feet. We also adjust the bones in the feet. The talus, the calcaneus, cuneiforms, the tarsals and the metatarsals and the phalanges. And you can probably hear some of those over there. But we believe in taking care of the entire person from head to toe, literally, because that's the way people's bodies work as a whole. You can't separate the ear from the body and the eyes and senses, and you don't want to do the same thing for the spine and nervous system and extremities. Okay, Natter, let's have you sit up sideways. There you go. And then just sit right there and look straight ahead for me. And I'm going to move your shoulders through a normal range of motion. And then we're going to take him over and do the spinal decompression adjustment on him, which is going to be the most beneficial treatment for his herniated disc. Okay, let me see your elbows for just a second. Good. Excellent. And we want to thank Natter for allowing us to video him today, coming all the way over here from Saudi Arabia and making that long trip. Is an honor and a pleasure.
This is mine.
Yep, that's right. Now, come over here for me, and we're going to lay you on your back. And I want to have you put your pelvis there, legs down there, and head up here on your back. Okay. Now, you've seen me do this one before on other patients. The first thing you have to do is line that pelvis up with the corresponding holes that are in the middle of this table. I then take pins, place them in to secure the pelvis, and it gives me an excellent point of stabilizing his pelvis so that all we're moving is on the y-axis is his vertebra from occiput all the way to his sacrum. And you notice I bring his legs up to parallel with the floor. He's in there pretty tight. Now, put this here. Keep your teeth together. Breathe through your nose for me. And just let all your air out. And just relax. There we go. And he did really well for his first time. You felt that all the way down, didn't you? Go ahead and lay there. Yeah, I just do this just to show that they're not paralyzed. That way they know. We've never really had anybody get hurt on this. It's very dramatic adjustment, though. You feel everything move?
Yes.
All the way from your neck down, huh?
Yeah.
Good. Now, also, we want to work these tensor fasciolata muscles because his pelvis is really a problem. But yeah. Now, he had a pelvic that elevated like that, so when I put it in this pin, see, that'll also straighten out his pelvic bones. And we're going to come over here. Work on these TFLs over here. This is called transverse friction. Going across the muscles, not the longitudinal line with the muscles. And that'll help break up the myofascial pain that's on those. And you always get those whenever you have subluxation in your sacroiliac joints. Okay, now let's have you sit up sideways and come over here and stand in front of the mirror. There you go. And let's have you stand here. Yep, see, he comes all the way from Saudi Arabia, and all I do is pull his legs and shoot him. So, what we're doing, this is a high velocity, low amplitude adjusting instrument for the Atlas. Now we're going to do the same thing, have you close your eyes and bend your head forward and then backwards. And then neutral, back to normal. Okay, that's improved his range of motion already, but, okay, you can open your eyes. Now, this is going to be your therapeutic exercise at home. And we always teach our patients how to look for this and do this. You see how your head's forward? And it's no, yours is all right now, and I'm just showing the viewers here. So you want to lift your shoulders up and hold them back like this for me. Your arms just like that, yep. Now, I'm going to bring your head straight back in the Z-axis. We're going to translate it this way. Up there. Now, shift your pelvis straight right for me there. Now, good. So we put him in an exact mirror image of his current biomechanics. And with this adjustment to the Atlas, you can relax now. With this adjustment to the Atlas sends information into the cerebellum, which creates what's called neuromuscular re-education. So let's flex your head forward all the way. Much better. Backward all the way. And now neutral. Now, did that feel easier?
Yes.
Look at the difference in your posture.
Yes.
Shoulders squared off, heads up and back more now. Pelvis is more centered. See how we still need to get that over to the right a little bit more though? Yeah. Okay, would you mind telling our viewers how that felt for the very first time?
Well, it felt great, and I appreciate the good work of Dr. Johnson, and hope that I can...
We'll be seeing each other again.
Be improved, yes.
Yes.
Thank you.
Well, welcome to Houston, and God bless you, and we'll keep you in our prayers. Thank you for watching. This is your Houston Chiropractor. We'll see you next time.